Good afternoon, guys. In this opportunity, I will be talking about collaboration between teams in healthcare, especially how good leadership skills facilitate the creation and maintenance of collaboration. This was reported in a paper by Stefano Senios in Stanford Graduate School of Business in What Hospitals Around the World Can Learn from India. And basically, Stanford University School of Business Engineering, Design, and Medicine was given a grant by the NIH to investigate healthcare advances. And that's how they came across this hospital in India called Narayana Hrudayalaya Cardiac Hospital in Bangalore. And this hospital started an initiative to address a rise in hospital-acquired pressure ulcers, and without no technology and limited resources, they were able to bring the prevalence of pressure ulcers from 6% to 0%, and also keep that prevalence over time. How they did this? Well, the number one strategy was leadership. And first of all, they set up like a small nursing team by giving the small team of nurses a leadership. That's how they started pretty much the changes in this hospital. And it's important to keep in mind that while it is often considered the nurse's responsibility when pressure ulcers develop, they're often powerless to influence the change of events that lead to them. So giving them a leadership role was very crucial. Leadership was also a theme in other aspects. They started with bottom-up education and top-down leadership. The leaders of all the different departments in the hospitals got involved. They were educated. They were educated in all different aspects of either how to prevent and what are the pressure ulcers, and they were all involved, as all the leaders as well as all the members and staff of the hospitals. They started making changes to operating rules and procedures, and they changed to paper documentation processes from processing of documentation that was done in computers, just so it could be easy and accessible for every member of the staff. And then when it comes to responsibility and performance, they single out the individuals responsible when one arose with, with constructive criticism, discussions of cases constructively also in weekly meetings with leads of departments. So pretty much they involved everyone, and they made it a point that everybody was aware of their responsibility and the importance of tackling this problem. Senior says that when a problem is everyone's problem, then it's no one's problem. Here was a case where making the solution to everyone's responsibility led to a collective wellspring of pride and success. And to summarize, the 5 steps to the solving of this problem in this hospital was based on raising awareness, increasing education, improving documentation and communication, implementing preventative practice, and creating best practices. And at each one of these actions, leadership was at the core. When it comes to raising awareness, by pretty much setting up a small team of leader nurses that were going to be responsible, and also giving more responsibility to the individual nurses as to which patient was affected. The increased education, the leaders were also responsible to bring down education from the top to the bottom, so everybody knows the new procedures and the importance of tackling down the ulcers. And also the improvement in the communication was very important because, by making this documentation in paper now, it was more easily understood by everyone. Implementing preventative practice was also very due to the type of leadership at the moment. And creating the best practice also always depends on leadership and how the leadership serve as examples. Thank you so much.